歡迎大家嚟到今日。
Welcome to the press briefing today. With us are Dr. Chuang Shuk-kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. Dr. Chuang will first brief us on the cases. As of last night, there were 11 newly confirmed cases, of which 10 carry the N501Y and T478K variant. One carried the L452R carrier, and the patient arrived from Thailand. Of the 11 cases, 8 were imported. One was related to an earlier case, and another was related to an imported case, and another is currently under investigation. That could also be related to a prior imported case. 13039 was related to an earlier case living in Block 3 of City Garden, North Point. 13041 was a cargo aircraft cabin cleaner. The case was detected through regular testing. She lived in Wangxin House, Chengwan Estate of Qingyi, which was subject to a restriction testing declaration last night, and 1,184 residents were tested, and all the results were negative. PolyU conducted a whole genome sequencing analysis for the case, and the results tallied with earlier imported cases. The results were almost identical. Some of those prior cases include arrivals from Finland, Nigeria, UK, US, etc. They were unlike the recent local cases, and the result did not tally with a prior patient who was a crew member on a passenger flight. Another case, 13045, a 43-year-old Pakistani housewife. On December the 20th, she took flight EK609 and EK389 and arrived in Hong Kong via Dubai, and she was quarantined at Silka Seaview of Yamate, and on the 10th she left the hotel and returned home. She lived in Tongmun Hao Dai Hang Tong Estate of Sham Shui Po, and she did not leave home afterwards, save for the 14th when she received a test. The result was positive. She carried the N501Y and T478K variant, which was Omicron. A person living next door in the quarantine hotel was also a confirmed case. It was a 71-year-old Pakistani man. On the 4th of January, he arrived in Hong Kong via flight RA409. They lived next door, and starting from January the 6th, he experienced discomfort, and the sample on the third day, that is the 6th, tested positive, and he then left the hotel. That case was number 12891. We suspected there could be a link between these two cases, especially when the recent case only tested positive in Hong Kong on the 26th day. We examined the previous cases, and we found that on the same floor in the hotel, there were related cases in 2 other rooms. And one room, number 12893 and 1298895 stayed in that room, and they arrived in Hong Kong on January the 2nd via AI 1314. And in the next room, case number 994 stay there. The patient arrived in Hong Kong on December the 25th. And on January the 10th, which is the 17th day, the result tested positive. The whole genome sequencing results of these 3 cases were available. They were very similar. And that is why we suspect that there could be transmission between these rooms. Our colleagues, Professor Yun and staff from the EMSD, are examining the site right now to see whether these cases were related and whether transmission took place. For case 13022, the latest test result was positive. The test results were negative for a few straight days. The viral load was very low, and we believe this was a re-positive case, and the patient's close contacts could be released. Today, we have less than 10 preliminary positive cases. One of the cases is currently untraceable. It is a 23-year-old female living in 4 Tongsheng Road, Aberdeen. She was a salesperson at Little Boss Jardine Street, Causeway Bay. That was a pet shop. There were multiple salespersons working there. And the patient has been working at this pet shop. Apart from work, she didn't visit many places. She would buy breakfast and eat at the shop, and she went to work at 11 a.m. and she would eat in the shop. And at about 4 p.m., she would order takeaway food, and she would have dinner at home. And on January the 5th, she dined with, she had dinner with friends at Low, which is a restaurant. And on the 10th, she didn't have work, and she stayed a night at a hotel in Wan Chai, but she didn't really use any of the hotel facilities. He ordered food and ate in the room. On January the 3rd, she visited Kamyut restaurant in Saiwan, and in the afternoon at night, she dined at a rice noodle restaurant, and the rest of the time she also ordered takeaway food. The patient carried L452R, which is the Delta variant, so this case could be unrelated to the Omicron cases. So we are tracing the source of infection. That's all for my report.
Dr. Lau will tell us about the situation over on the HA side. That's at 9 a.m. today. Over the past 24 hours, the HA system recorded 17 cases. Over the past 24 hours, we had an additional 27 patients discharged upon recovery. As of now, 12,393 patients have been discharged upon recovery. As at 9 a.m. today, 388 patients were currently staying at the North Atlanta Hospital, the Hospital Authority Infection Center, and the Asia World Expo facility, as well as other public hospitals. For the 388 patients, they're all in a stable condition. That's all from me. The floor is now open to questions. Please tell us your organization before putting your questions to first. The lady in white. I'm from Now News. A question about the 23-year-old female, the untraceable case. She's been to the restaurant called Hoi Dai Lo, and then she stayed at Value. How many people were with her on her trips? What's her CT value? Does it mean that we have silent transmission chains for both Omicron and Delta variants? Her CT value is 21. At the hotel, she was with a person, and then she was with 4 other people at the restaurant. So that looks like we do have another source of infection. Next question. The lady over there. HK01. A question about the 23-year-old female, the untraceable case. You said that she works at a pet store. She does a lot of takeaway food, and she takes off her mask while having meals. Does it mean that the pets would have to be quarantined? You said that there may now be another transmission chain in the community. What's the CHP's assessment of transmission in the community? We see lower case count, but does that mean that we still can't drop our guard yet? And the question about the Silka Seaview Hotel. How wide apart are the 4 rooms you were talking about? What's your assessment of the risks of the virus spreading between those 4 rooms in Silka Seaview? She would do takeaway food, and she had her meals inside the pet store, away from the pets. Her work involved cleaning the cages for the pets. They sell rabbits, hamsters, etc., and chinchillas in the pet stores. And she would also show customers the pets when the customers come in. And for Silka Seaview, we have our colleagues and Professor Yun during an inspection of the place. We're talking about 2 floors. The 4 rooms are on different floors. They will meet the press in due course, and they will tell you more details. Next question. The gentleman at the back. Dr. Chang, I'm from TVB. A question about the lady who works at the pet store in Causeway Bay. Have we had infected cases visiting the pet store? Or is she related to any previously infected cases? The second question, it has to do with the hotel in Yamate. Do the staff who work at the hotel need to be quarantined? You said there are 2 floors involved. How many rooms in total are involved, and how many guests are involved? A follow-up question about some previous cases. As far as you know, the 41-year-old cabin cleaner, why is it that she got tested 1 test after 3 days? Is that a breach of protocol? A final question about for Nabe Urara. Have you been able to track down the last 2 customers? And for the people who have already been sent to quarantine, have they developed symptoms so far? And for the 2 people out of reach so far, is that a high risk for the community? Now we're still investigating whether other infected persons have visited the pet store in Causeway Bay. But now we know there's a L452R strain involved that may not be related to the recent infections we've seen. The recently infected persons have not visited the pet store. Turning to the hotel. For those who stayed at the hotel around that time, those people will have to get tested. But the hotel staff won't have to be quarantined so far. Now we're talking about 2 floors, 4 rooms at Silka Seaview, but the investigation is ongoing. So Professor Yun and his team will tell us more when they are done with the investigation. Turning to Nabe Uwara, the latest figure we have is that we have been able to identify 40 customers. 39 have been sent to quarantine camp. There are 2 other tables. These customers settle the payment with cash. We have yet to trace them. Some used a prepaid SIM card. So we have yet to get hold of a few customers. So we're calling on those who have been to Nabi Uwara to reach out to us. Some have indeed reached out to us. What was your other question? Sorry. We still have to clarify with the company and the people involved. Next question. At the back towards the center, the reporter in white.
From TMHK. So the first one is for the unlinked preliminary positive case. There are two different strains of COVID spreading in Hong Kong, Delta and also Omicron. So is it alarming? And what do you think is the possible source of infection for that staff? And also for the infections in Silka Hotel, would you consider having people quarantining in the hotel for 21 days as more dangerous than 14 days? Because in the hotels, because it appeared to be infected in the late stage in the quarantine. Thank you.
For the unlinked case, of course, there's we identify another possible sources of infection in the community. There may be Delta strain circulating. So it is not only restricted to the Omicron cases we detected recently. So of course, we are very worried whether there are other sources of infection that has not been detected. And as for the sources of infection, we are still investigating all kinds of possible sources of infection. So we do not have any conclusion at the moment. For the Silka Seaview Hotel, I understand the investigation is ongoing at the moment. So please wait for the later press stand-up by Professor.
下一題係問到條英文問題。
Take another English question.
Good afternoon from SCMP News. I would like to ask about the 43-year-old Pakistani lady. You've mentioned earlier that she was mostly staying at home, but how do we ensure that she did not go out at all? And are there any of her family members who are going out as well? So, if so, are you worried that there is any possible outbreak in the local community because of this? My second question is on the unknown case today for the 23-year-old lady. How many colleagues are considered close contacts? And also she stayed in the One Chai Hotel. Does that mean that the hotel is also carrying some risk? My third question is on two security guards who have now tested positive in Penny's Bay. Is it possible that there is an outbreak of cases in Penny's Bay? Any risk to those who are quarantined or working there? And did these security guards also interact with people coming from outside the quarantine center? Thank you.
Before that, I forgot to mention that the preliminary positive case, she developed sore throat and cough on 11th of January, and she self-medicated, did not seek medical attention, and then she went to an outpatient clinic to get a diphtheral saliva and submitted the specimen on 15th, and then has been tested positive. So I would like to appeal for the public that if you get any symptoms such as sore throat or cough or mild, even it is mild, please get tested as soon as possible or go to seek medical attention as soon as possible. So for the positive confirmed case 13045. She finished 21-day quarantine hotel already, so she's allowed to go home, and the day 26 test is additional precaution, for test. So she's allowed to go out, but she did stay at home with her children. Her family members went out. I mean, her husband did went out. So the possible sources of infection may be from the community or from the hotel, but we need the whole genome sequencing to confirm this. But since there's some linkage with the room numbers in these hotels, that's why we are doing some investigation to try to find out whether her infection is linked to the quarantine hotel. And for the Penny Bay Quarantine Center, the 2 cases who work as security guard in the Penny Bay Quarantine Center, the 2 guards, they share meals together. They are meal friends. So it is, it is possible they can infect one another, but they will wear full personal protection equipment during work and have very little contact with the confinees. So we have quarantined all their close contacts, such as those who share those container and meal together. Those people we consider as close contacts, but this do not include those confinees. I do not have the details of her whereabouts of her husband. Her husband and the children will be put under quarantine. So I understand she has 4 children. Yeah.
下一題啊，後面嗰行最遠。
Next question, the reporter on the back row, please. I'm from RTHK. For the 23-year-old girl, before she tested preliminary positive, she visited a number of places since the L452R strain was involved. How do you see the risk of infection or a spread in the community, and would the additional quarantine arrangement increase the risk in the community? On the 11th, she experienced sore throat and coughing. She didn't seek medical attention, and on the 15th, she provided a sample in Aberdeen. The result was positive. CT was about 21. So it has been a few days since the 11th, so there was a risk of spread in the community. And during this period, she mainly reported to work. And on the 10th, she went to the hotel. And before that, she worked at the shop. And she last dined with friends on January the 5th at Hai Di Lao Hot Pot of Yamate. On the 3rd, she dined at a restaurant specializing in pork chop. So we are concerned about the risk of transmission between the 11th and now. So because we see a risk of a spread in the community. Next question. I'm from cable TV. For the 23-year-old girl who tested preliminary positive, she carried the Delta strain. What do you think was the likely source of infection? How many people related to her case had to be quarantined? Did the restaurant staff and staff from the same pet shop had to be quarantined? For the 43-year-old Pakistani woman, during the quarantine period, she tested negative 6 times, and subsequently she entered the community for 4 days. What is your assessment on the risk of a spread in the community? The preliminary positive case carried the L452R strain, which could be related to the Delta variant. These cases could be caused by external factors, and it is still under investigation. So far, we do not see an exposure history related to any prior cases. We would wait for the whole genome sequencing results. For friends and family members who dined with her, that's for the preliminary positive case, and those who worked at the same workplace, they dined together, and that's why they were sent to quarantine as close contacts. For the case in which the result tested positive on the 26th day, the patient mainly stayed home, and if his family members went out, that could be a risk of transmission. Next question. I'm from Mingpao. Again, for the 23-year-old female who tested preliminary positive, you said her family members and co-workers were close contacts. How many people in total were involved? Was she vaccinated? She dined at Hai Di Lao Hot Pot in Yamate. Did other patrons of the restaurant have to be quarantined? For the aircraft cleaner, we asked about the flights she worked on. Was it did they include international or domestic flights? For Nabi Urawa, did any patrons test preliminary positive? There were approximately less than 10 close contacts, but this is to be confirmed. She received 2 doses of the Sinovac vaccine. She dined at Hai Di Lao, and there was no outbreak, and the other customers did not have to be quarantined, but people who visited the restaurant had to be tested. For the cargo aircraft cleaner, since the 10th, there were about 40 flights, including international flights from different places. You completed a whole genome sequencing for the case, and the result tallied with the prior imported cases. And we looked at the cases. The patients came from different places, such as Nigeria, US, Canada, Finland, etc. The sequencing results tallied with this case. But the results did not tally with the 2 clusters in Hong Kong and an earlier aircraft cabin cleaner. We have no new cases so far for the Nabe Urawa restaurant. I'm from AM 730. For the 23-year-old girl, do we know the where the pets in the store came from? Do the pets in the store have to be quarantined, since all the staff members working there are already quarantined? Can you provide an address for the pork chop restaurant in Saiwan? For Hai Di Lao, was buffet services offered, and are you concerned about a spread? For Nabe Urawa, would there be new arrangements? We are investigating the origin of the pets in the store. Normally, if a close contact is sent to quarantine, normally they would ask their friends to take care of their pets. If that is not possible, they could seek help from the AFCD, but the pets do not have to be quarantined. For the Ayat A1 pork chop restaurant, well, I'm not very sure about the address, but we might include this restaurant in our compulsory testing notice. Both are located on Belcher Street, Saiwan. That is A1 pork chop and Kem Yut restaurant in Saiwan. For Hai Di Lao, it is located on 555 Nathan Road, Yamate. And for people who took their masks off in a restaurant, there is always a risk of transmission. So the relevant patrons and staff had to be tested, but it's not possible to send everyone to a quarantine center unless there's an outbreak.
Speaker's not using a microphone. As for that, case, it depends on the results of the investigation. Next question, lady at the front. Oriental Daily. Now we have an untraceable case involving the Delta variant, and we also have many Omicron cases. Are you worried that we will see Delta Cron cases in the days to come? Professor Yun Kwok Yung has finished the inspection. They have done a test with the airflow. The air would apparently flow from room 1205 to 1206. Does it mean that you will review the situation with regard to air purifiers at all quarantine hotels to prevent similar things from happening? Another question. For the 23-year-old preliminary positive case, she spent a night at the hotel. Would you also have someone inspect the hotel to see if there's a risk of airborne transmission of COVID there? We have untraceable cases in the community. That means there are silent transmission chains in the community that have yet to be identified. Any delay in identifying such cases, or if infected persons have been to crowded places leading to transmission, then we could expect exponential increases in cases and hence the risk. I'm not sure about what they have found out about at the hotel yet, but our colleagues will make improvement where possible. We don't have any other things coming up at the hotel where she had the staycation. But the people involved will have to get tested, and we will look into any things that may warrant further investigation. Over here, Hong Kong Economic Times. A question about the 23-year-old preliminary positive case. Her CT value is 20 or 21. That's her viral load is not low. Do you see a particularly high risk? We don't know where the pets are from. Do you think it's possible to get the pets tested? In this incident, what's the likelihood of the pets passing on COVID to human beings? We will investigate all possibilities. Her CT value is on the low side. That means there's a risk of transmission. Starting from January 11th, she started feeling unwell. She got tested on January 15th. And that's in line with what we can expect. So there is a risk of transmission in the community. Any other further questions? If there is no other further questions, that concludes our press briefing today. Thank you.